My name is Ramona, and I had been misdiagnosed for about 3 years prior to coming here, and nobody could tell me what was wrong with me. I was having dizziness, migraines, light hurt my eyes. I was having trouble moving my neck from side to side because it would hurt too much. I had to quit working because I was just not able to do anything. When the pain got worse, I was put on oxycodone, which was hard for me to stay on, but it eased the pain, but only to the point where I would take it and go to bed and sleep, wake up, be in pain, take more oxycodone, and then go back to bed. So I did that for like maybe 2 weeks at the most, and I knew in my head it wasn't the answer. I just knew something was wrong with me.
I was actually a candidate for TMJ treatment, and I didn't even know it. And this is why it's a huge passion of mine, to help patients who've been suffering with this, with headaches, migraines, all of these other symptoms, so that their lives can be better and they can have less pain going forward, especially when you've been told by doctors there's nothing wrong with you, or there's nothing on your MRI, or there's nothing on your CT scan. You're just fine. There's nothing wrong.
I started searching on the internet, and that's when I saw the bio on Dr. Rayani, and it wrote down a lot of questions that sounded like me. So I called, and when I met Dr. Rayani, she said, "You know what? I know already what's wrong with you. I saw how you walked in, and let me tell you what you're going through and what you're feeling." She goes, "You have migraines. Yes, you are feeling like nobody believes you." I said, "Yes." And she was going through all the symptoms, and I was saying, yep. And she knew right away. There was no question in her mind.
At the beginning, it was a migraine a month, and then it went to about every week I'd have a migraine, and it would be intense the first day, bright lights, nausea. Then the second day, I just would feel like I would have been run over by a truck. So many patients who have TMD or TMJ are reliant on pain medication, because when that migraine kicks in, or that headache kicks in, or that jaw pain kicks in, the first thing they reach for is either ibuprofen, naproxen, something that's going to take that pain away. And they end up making you very dependent on them. So patients who go through this treatment, the fact that they don't have to take medication anymore is like a godsend.
She said, "You are an extreme case. We got a lot of work to do, and you won't get pain relief instantly. It's going to be a process. We can put a guard in your mouth for now to keep you from hitting your teeth and to give you some relief." And she explained to me what was happening within my body, within my jaw, my shoulder, my back. Everything was deteriorating. And that was the result of TMJ.
Really, I was the guinea pig who started the whole process at our office. My husband took a class, and he learned some things about TMJ, and he said, "We have to do this on you." We started the treatment, and since my TMJ splint, because it's working, I have not had any migraines. I have not had severe headaches, a whole gamut of symptoms for TMJ. We're all relieved.
I believe in Balfour Dental. I believe in what they do for other patients. I've seen other patients with TMJ sitting and going through the TENSing like I had to. And I spoke to one time. I said, "It works. Give it time, because it really works. Don't give up. It will work for you."